Hi everyone. I decided to use the time during the coronavirus lockdown to create this YouTube video. One reason for this video was that several people on TV and podcast shows mentioned that this pandemic is unprecedented and never happened before. And this suggested to me that some people are unaware about pandemics and, in particular, the big one that occurred a century ago during 1918 to 1920. For those who have not heard about it, it was called the Spanish flu because the Spanish press was the first one that reported about it. But the real origin of this flu is uncertain. At the beginning of the outbreak, World War I was still ongoing, and historians found that infected soldiers from abroad brought the disease to Spain. In Spain, it was known as the French flu. Victims with severe symptoms showed signs of nose bleeding and cyanosis, which means bluish skin color, due to the lack of oxygen in their bloodstream. So, the reason for that was severe pneumonia during the flu infection, which resulted in the accumulation of fluids in the lungs, and this thereby prevented the uptake of oxygen into the blood system. And because of that bluish skin color, the disease was also called the Blue Death. Cyanosis is part of the acute respiratory distress syndrome called ARDS, and that can also occur in severe COVID-19 patients. A way to treat these patients are by using ventilators that create additional pressure, which helps oxygen to get into the bloodstream. Like during the coronavirus pandemic, also during the 1918 flu pandemic, everyday life was hindered. Some communities closed all their stores, and the disease also forced people to carry face masks. However, at that time, the doctors did not know about viruses. No antibiotics were available to treat secondary infections. Antivirals didn't exist, and no vaccines, and also no ventilators. So, because of this, there were not many options to treat these patients properly. To really understand the impact of this 1918 flu pandemic, we need to look at this graph. This figure shows the average life expectancy over time in the United States. And we can see how devastating this pandemic was because it reduced the average life expectancy more than 12 years, showing here by this dip. Another way to demonstrate this impact is by looking at the numbers in this table. It's estimated that between 20 to 100 million people died worldwide because of the Spanish flu. That is more than people died during World War I with 17 million. And as a comparison, the recent numbers during COVID-19 pandemics, while this video is created, are around 85,000 deaths. This number will increase over time, but still it's very unlikely it's going to be that bad as the flu pandemic in 1918. Because we have to look also at the relative world population during that time, which was around 1.8 billion people. So if we adjust the numbers to the world population we have today, that means the Spanish flu would have killed 86 up to 433 million people worldwide. One thing that was particularly puzzling about this flu pandemic was that it killed also many healthy young adults between the ages of 20 and 40 years. And that is the reason why we see this W shaped curve instead of the regular U shaped curve that you would expect normally to see. So in contrast to that, using the data from New York State during the COVID-19 lockdown, it shows that particularly elderly victims over the age of 60 years die of COVID-19 complications. Still, this does not mean that COVID-19 does not impact younger people because they may still end up being hospitalized. The analysis of the reconstructed DNA sequence of the 1918 influenza virus suggested that the virus originated in birds and that the predominant natural reservoir, which means where a virus naturally reproduces itself, is in aquatic birds. It is also thought that the transition to humans occurred through an intermediate host, such as a pig, where the virus mutated and then passed on to infect humans. In the case of COVID 19, the DNA sequence suggests that the virus most likely originated in bats, and it is currently thought that pangolins passed it on humans. However, given that COVID 19 can infect different species, for example, like the tigers at the New York Zoo that got sick with the coronavirus, it will be difficult to really pinpoint the intermediate host. To shortly compare how these viruses enter human cells, here on the left side we see the influenza virus that requires binding of the hemagglutinin protein, also known or also called as HA protein, that binds to sialic acid receptor on the surface of host cells. The name hemagglutinin derives from the ability that this protein on the virus can glue red blood cells together. On the other hand, the coronavirus uses the so-called spike protein, which binds to angiotensin converting enzyme 2, called ACE2, and this enzyme plays a role in reducing the blood pressure and is also present on lung cells. So, vaccines are designed usually to generate antibodies against these virus binding proteins. However, viruses can mutate over time, especially the influenza virus mutates substantially so that every year one needs another vaccine. And so far, what I saw is that the coronavirus does not mutate as frequently as the influenza virus, which is a good thing for generating an effective treatment. The most recent data in New York, while I'm working on this video, suggests that the peak of the COVID 19 outbreak may have reached, and the lockdown is scheduled till April 29th. So the question is what happens afterwards when the lockdown is removed? That's why I wanted to compare the data from the 1918 influenza pandemic to maybe get a better understanding how long this coronavirus or this pandemic may impact the countries. If you look at the data from UK, there was a first wave in summer 1918 that wasn't that bad. But by the winter, a second wave spread across the globe and the virus had mutated to a far deadlier version. And depending on the country, there was even a third wave. Of course, we cannot compare directly these waves with the coronavirus, since the influenza virus is different. Its transmission is strongly affected by seasons. And initially, it was thought that the COVID 19 transmission may also stop in the spring and possibly reappear in the next winter. But since there is such a geographic spread of the coronavirus across the world, even in countries with warm temperatures, questions that initial thought. Still, we have more options to treat patients than 1918. Some people argue for economic reasons we should stop the lockdown and take calculated risk in which elderly people and people with preconditions could easily die. The problem for people arguing for the economic reason is that they underestimate the coronavirus, which has the potential to mutate and become more aggressive, and thereby can also kill younger people, like, for example, the flu pandemic in 1918 has demonstrated that. It is unlikely that the coronavirus will mutate that way, but there is also no guarantee that it will not happen. So I'm monitoring the death rate of the coronavirus over time, and looking at these numbers, this shows that the death rate is close to 6% worldwide. This is 2 to 6 fold times higher than the numbers that were mentioned a few weeks ago, ranging from 1 to 3%. So this mortality rate slowly increases. I'm just not sure how much is this related to the testing. If the testing changed, maybe that's that the testing is more focused on the really sick people, and that's why the rate is increasing, or if this may actually indicate that the virus becomes more aggressive. We don't know. So it's important to keep an eye on this, if this death rate will further increase or stay at a certain level. Basically, we need to be very cautious with our approaches till we have realistic treatment options. Besides vaccines, which can take up to a year or longer, several other drugs against COVID 19 are being currently tested, and we may get some results how effective they are in the next coming weeks. So I wish everyone to stay safe and healthy.